Now let's move on to the APTT, or the activated partial thromboplastin time. So the principle of APTT is as follows. APTT measures the clotting time of plasma after the activation of contact factors, but without added tissue thromboplastin as compared to your PT. Again, in PT we use thromboplastin. In APTT we don't. But what we are, I mean, the end product that we are looking for is the formation of clot, right? Now, APTT indicates the overall efficiency of the intrinsic pathway. So as opposed to the PT, nga ang gina-assess niya is the extrinsic coagulation pathway, the APTT naman is used to assess the intrinsic coagulation pathway ng pasyente. It is also sensitive to circulating anticoagulants or inhibitors, as well as sa imong heparin. So basically, if a patient is undergoing heparin therapy, ang usual ginaya nga test nga ginasubject kung sa diin ginasubject ang pasyente will be APTT. Again, APTT is used to monitor heparin therapy kung naga-heparin therapy man gid ang pasyente. Your APTT depends on contact factors such as your prekallikrein and your high molecular weight kininogen. It is also dependent on the factors 8, 9, as well as the factors 10 and 5 factors, the prothrombin factor or factor 2 and your fibrinogen. Please do take note all those factors that are being monitored by your APTT as well as your PT. So when we say contact factors, they are basically the substances or factors in the coagulation pathway that basically activates your factor 12. So examples again of your contact factors will be your prekallikrein and your high molecular weight kininogen. So these are the reagents that we use for the APTT. We have the platelet poor plasma, which is basically the same with the PT. Sa PT gagamit man ta PPP mo, platelet poor plasma. Sa APTT, the same. We also use platelet poor plasma. We use kaolin, which is mixed with barbitone, buffered saline, with a pH 7.4. Others, other procedure or other methods use silica, salite, or ellagic acid. Phospholipid is also being incorporated. Calcium chloride is also being used. So here is the method for the APTT. And just to clarify, we don't have video demonstration for the PT and APTT because we are kind of lacking of some of the reagents. And initially, what we only have sa aton nga laboratory manual is the PT. We don't have any steps at all or the laboratory guide for the APTT. Going back, this is the method for the APTT. We first mix equal volumes of phospholipid reagent and the choline suspension and leave in a glass tube in the water bath at 37 degrees Celsius. Then we place 0.1 ml of plasma into a new glass test tube. Then we add 0.2 ml of kaolin phospholipid solution, which we get from step 1. Then we mix the contents and start the stopwatch simultaneously. So basically, the substance or the mixture that we got from step 1 will be mixed with the 0.1 ml of plasma. And then we start the stopwatch, and yeah, we leave the mixture at 37 degrees Celsius for 10 minutes with occasional shaking to promote the um, somehow activation of your clotting factors there. At exactly 10 minutes, we add 0.1 ml of pre-warmed calcium chloride and start a second stopwatch. Then we record the time taken for the mixture to clot. Again, pareho sa PT, what we're looking for sa APTT is the formation of clot. Then we repeat the test on both the patient and the control plasma at least once. So basically, we perform APTT on the control, and also we perform APTT on the sample of the patient. And we do the procedure twice on both samples. So basically, we have two results, APTT results, with the use of the patient sample, and we also have two APTT results for the control plasma. Right, so um, you have there two test tubes, right? On the first test tube, the test tube on top is the one that shows a successful clot formation. So basically, um, successful magandang APTT nga procedure or method. On the other hand, the tube below or on the bottom shows you no clotting at all, since liquefied pa ang plasma. So basically, ang magwa they would be prolonged APTT sa bottom ng tube, which means wala nanging successful um, ang pag-form ng clot, and that means there might be something wrong with the intrinsic coagulation pathway of the patient. Now, for the interpretation of the result, we have the normal reference range, which should be 30 to 40 seconds. A prolonged APTT, which means greater than 40 seconds ang nakuha ng result. Prolonged APTT na siya. With normal PT, again, if there is a prolonged APTT with normal PT, that would indicate a possible deficiency of factors 8 or factor 8 or factor 9, or may deficiency kita sa factor 11 or sa 12, or may deficiency kita sa contact factors like the high molecular weight kininogen or prekallikrein, or may ara ta presence of inhibitors. Inhibitors ng ano? Inhibitors ng imo nga clotting factor 8, 9, 11, and 12. Right, so we have another another image which will show you how APTT is being done. So for example, we have a plasma that is deficient of a specific factor. Let's say wala siya factor 10, right? And then we have a normal plasma nga ara siya tanan nga kumpleto siya sa coagulation factors. Right? So basically, kung may deficiency gani sa factor 10 ang plasma, ano ang iyang APTT result? Abnormal or prolonged. Now, how about sa normal plasma? When you say normal plasma, tanan gani nga coagulation factors may ara siya. Ano ang result, ang APTT result sa normal plasma? normal, right? So in this case, one of the plasma samples deficient, may prolonged APTT, which means pwede nga may deficiency sa isa ka clotting factor. Right? So we try to determine kung ano manggid ang ang clotting factor nga deficient ang sample, right? Or ano nga klase nga clotting factor ang wala sa sample. And we do this by trying to mix two types of plasma. The plasma which is deficient of a specific clotting factor, and we also mix it with a plasma nga normal. May normal siya nga concentration of clotting factors. Let's say um, we test for the deficiency sa clotting factor 10. Okay? So let's say ang samples ng pasyente, no, we try to think lang tanay, base deficient sa clotting factor 10. How do we confirm if deficient na ang sample sa clotting factor 10? We do that one by getting a plasma that is having clotting factor 10. Right? Makuha to plasma nga may clotting factor 10. And wala siya ibang clotting factors. Clotting factor 10 lang gigabi. Right? So pag mix na naton, ang mixture nga inihila is subject na for the APTT test. If mag-normal gani ang APTT test, that means inchakto ang aton nga guess. Ang wala nga clotting factor sa sample sang pasyente is the clotting factor 10. Paano nato na-confirm na ang sample sang pasyente deficient sa clotting factor 10? Because pag mix naton sang plasma nga may clotting factor 10, gulpiyada ang iya APTT nag-normal. Nag-normal siya. That means may deficiency sa clotting factor 10 ang pasyente. That's how we confirm what specific clotting factor the patient is lacking. Now, how about we try to identify if the reason for the prolonged APTT sa sample ng pasyente is because of the presence of inhibitors. We try to experiment on this man. We try to do some test man. Okay. For example, this is the sample of the patient. Right? So gintest na ni siya beforehand, and ang nagwa ang iya APTT is prolonged. So we try to make a guess. Base may inhibitor ang samples ng pasyente. Base may ara siya inhibitor for the clotting factor 10. And that's the reason why prolong ang APTT niya kaina. So, how do we confirm if may inhibitor against clotting factor 10 ang samples ng pasyente? We get another sample, right? Separate na sample, kung magado ka-control naton. We get a sample which has clotting factor 10. Okay? Ang unod yun lang would be clotting factor 10. Sa sample, sa plasma hina, ang unod yun lang ang clotting factor is clotting factor 10. Alright. So, duwa lang na ang matabo. Duwa lang na ang matabo, no? Kung wala inhibitor sa test sample, the APTT will be normal. Kung i-mix class lang nga duwa. But, if may inhibitor ang test sample or ang sample ng pasyente, pag mix mo ni sang control kag test sample sang pasyente, ang iya APTT result will be prolonged. So parehas ni sa natabo sa picture, no? We mix the two samples. The first one, which has an inhibitor against clotting factor 10, and the other plasma contains clotting factor 10. So pag mix mo, the inhibitor from the first plasma sample will inactivate the clotting factor 10 nga ara sa second plasma nga sample, or in this case do ka control naton. So nung nagwa nga APTT result niya nag-prolong. So pag prolong ganyang sample, we can confirm ay nag-prolong ang original APTT results ng pasyente because in the first place, may inhibitor gali sa iya nga sample. How did we confirm nga may inhibitor manggid sa samples ng pasyente? We mix the sample of the patient with another plasma sample nga may unod sang isa ka specific na clotting factor. Okay? In this case, ang ginhimo ta, nag-add ta sang sample na may clotting factor 10. And nagwa, after mixing, gin-test for APTT, nagwa prolonged APTT result, which means may ARA inhibitor against clotting factor 10 ang pasyente. Right? So, I hope maintindihan nyo nino, but I'll do my best to explain this one. So, related man siya sa previous nga picture. Let's say ang APTT control mo, ang control, may ara siya APTT result nga 35 seconds. Right? Sa control naton. Ang control nga plasma, gin-test for APTT, ang iya nga, what do you call that one? Ang iya nga APTT result would be 35 seconds. Ang test sample naman niya, which means ang plasma ng pasyente gin-test for APTT. Tapos ang result is 60 seconds. Uyala, 60 seconds, which means this is not normal anymore. Wait lang gid ha. This is not normal nga APTT. This is already prolonged APTT. How about ang control naton? 35 seconds. Sulod pa siya sa normal reference range. 35 seconds to pag ginang control mo. So ang normal reference range natin is 30 to 40 seconds for APTT, for your APTT, which means ang 35 second nga APTT sang control tadi is normal. Right, so we have normal APTT nga control and prolonged APTT for your test sample. So, kung may prolonged gani nga APTT, the next thing that we need to do is to determine what has caused the prolonged APTT. Anong reason? Ang reason bala, factor deficiency, or ang reason bala is the existence of a specific inhibitor. So we try to determine kung ano mang ginang cause by doing this one, right? Mixing. So if we did a 50-50 mix, tapos kin-test na siya for APTT, kag ang naguha would be 42 seconds. This is already a good correction, right? Okay, from 60 seconds nga APTT sang aton nga test sample, nagnubo siya into 42 seconds, which is quite lapit-lapit lang gid sa normal reference range ng imo nga APTT, which is 30 to 40 seconds. This is a good correction. So kung amo ni ka drastic ang change, amo ni ang grabe nga pag-improve sa APTT, no, to the point nga mas lapit siya sa normal reference range, ang 50-50 mix, that means probably may factor deficiency manggid. May factor deficiency manggid ang pasyente. So ano niya miss ang calculate mo de? we just want to see the relationship lang gid between the 50-50 mix and of course the APTT sang test sample naton, as well as the test sample and your APTT sang, I mean the APTT sang test sample and APTT sang control. So first, we try to set danay sang kumbaga threshold amo nang basihan naton. So we do that one by getting the difference between the APTT of the test sample, which is 60, minusan mo siya sa 35, and we have 25. The answer is 25. Then, this specific number nga 25, hang on, ariyo, the AP first maseta na isang threshold. We get the APTT of the test sample and minusan ta na siya sa APTT sang control. We get 25. And then 25 will be divided by 2, showing you the mean between the APTT of the control sample and the test sample. So we divide it by 2, we get 12.5. And this is what, and this will be our threshold. So, muning basihan naton. Alright, so save lang na siya danay. Next, we try to get the amount of time or ang difference sa time sang APTT of the 50-50 mixture and the APTT sang ating test sample. We do this one by getting the difference between the APTT of the test sample and the APTT of the 50-50 mixture. So 60 minus 42, we have 18. And we try to check if sulod man gid no ang 18 sa threshold or hindi. Pag greater than the threshold, which is the 12.5, that means good correction ang natabo. Alright? Good correction natabo. And that means ang problema sa pasyente might be a factor deficiency. Now, what if we do the 50-50 mix and we got a 52-second APTT? Same thing yapo no ang himuon naton. First, we get the threshold danay. Right? We get the threshold. Bali, 60 minus 35, we get 25. Divided by 2, we have 12.5. Right? So, isave na ng 12.5 next. We try to get the amount of time or the difference in the amount of time of the APTT sang sample, test sample, and the APTT sang 50-50 mixture. So, 60 minus 52 is 8. Then we try to check if sulod bala sa threshold ang 8 or hindi. So basically, sulod siya sa threshold, less than 12.5 siya. Kung less than 12.5 siya, that means there is a poor correction. That means probably ang pasyente may ARA inhibitor that inhibits the clotting factors of the intrinsic pathway. So let me just erase this one. Right, so basically, nag-involve the calculation sa diri nga part, but visual-wise or kung gusto nyo gid mas maayo nga pag-intindi, pwede nyo gid matun-an ang slide, ang previous slide which shows you how correction is being done. Right, now here are the causes of prolonged APTT. You have your still disseminated intravascular coagulation. Hang on, let me erase this. right? Disseminated intravascular coagulation. The next we have liver diseases, massive transfusion with stored blood, administration of heparin or contamination with heparin could also prolong APTT. That's why we don't really recommend of using heparin, right? The green top tube in in venipuncture collection of the blood sample sang pasyente because the traces of heparin will really affect the APTT sang pasyente. If the patient has a circulating anticoagulant, that might also prolong the APTT. And of course, if there is any deficiency, if there is deficiency in any of the coagulation factor other than factor 7, then that might prolong also the APTT.